I'm Dr. Benjamin Anderson. I'm a hospitalist here at Logansport Memorial Hospital. I've been here about 6 years now, this coming July.
Good afternoon, I'm Todd Weinstein. I am one of the surgeons here at Logansport Memorial Hospital, and I am Chief of Surgery. It was in my role as Chief of Surgery that I was part of the team trying to lead the hospital's response to the COVID.
Hi, my name is Dr. Akande. I'm a family physician here at LMH, or Logansport Memorial Hospital. I work on both the outpatient office side as well as the inpatient hospitalist floor.
My name is William Murray. I am a physician here at Logansport Memorial Hospital. I'm an obstetrician gynecologist. I am currently department chairman for our OB newborn section. I have been involved very much so with the morning incident command meetings with the hospital. Several physicians, including myself, had requested that we be a part of this planning process and have been there pretty much from the beginning in helping to plan and make arrangements for the onslaught of the COVID virus.
I am Dr. Rene Gutierrez, and I usually work at the Express Medical Center. During the COVID-19 pandemic, I was more or less one of the physicians who worked at the 4-H Fairgrounds Clinic to meet the demands that we were having at that point in time with testing and pretty much all the needs that the community required.
I'm Dr. Corey Newman, and I'm a family physician at Logansport Memorial Hospital. I was involved with the incident command, did a lot of telehealth at home, and also was involved in the COVID unit on the floor.
I think honestly being independent, I think is something that really helped us adapt and change things rapidly. Whereas I think if we were part of a larger organization, there'd be so much work that would need to be done in terms of getting approval to do new things or different things. Instead, we got together. We were having meetings on a daily basis with administration and everybody involved who would need to be involved to make decisions, and we were able to prepare and adapt very rapidly to the changing situation. So one of the things that I think really contributed was that we had the respiratory clinic that we were able to get set up well before we actually started to spike our cases. And because of that, we had all these people who were in the respiratory clinic who were being tested, and then if they were positive, we were following up with them on a daily basis, trying to make sure that they were still doing okay from a symptom standpoint, and if they weren't, we directed them to the emergency room. So the vast majority of the time, when somebody came to the emergency room, we already knew that they were positive for COVID if they were a COVID patient, because we had already had them seen in the respiratory clinic as soon as symptoms started, and we were able to get the tests out and get those test results actually back. In most of the cases, we had the test results back before they were even sick enough to be admitted to the hospital. So I think that did a couple of things. Number one, we knew exactly what the problem was when they were coming in. They were a COVID patient, and we were able to treat them accordingly. Number two, it allowed us to protect our staff because we were able to use full PPE and know what we were dealing with going into it.
Because we did become a hot spot, we are also eligible to use the drug remdesivir, and we also had convalescent plasma that we're able to use on our sickest patients, which I do believe helped prevent some of that from happening.
Yeah, absolutely. I was involved with the daily calls, and I really think everybody was very proactive, trying to do the best that we could with the resources that we had, and I really think that did help tremendously.
I really think that communication here was the biggest factor in us being able to mitigate any situation that could have gone wrong.
COVID is different than a lot of the other infectious diseases and viral diseases that we've seen in that it is very highly contagious. Some diseases are harder for one person to give to another. COVID is very easy for one person to give to another, and so it spreads very easily. And then it also is more fatal than a lot of the other diseases. If you look at influenza A, influenza B, you're looking at death rates less than 1%. With COVID, the death rate is probably more in the range of 4%.
So, and there's still so much that we're learning about COVID. So, I think this will be a question I'll be able to tell you a whole lot more about in a year. But right now, one of the things that we see, or at least that has impressed me, is the extended course of it. People, when they first get symptoms is not when they really get sick. What has happened is it's usually day 7 to 10 into somebody's symptoms that they really start to get ill. That's a little different than a lot of other diseases. Most diseases you get sick, real sick up front, and then typically you're going to start getting better. Most of the time, if you're a week into something, that's not when you start to get sick. In COVID, that's the case. And the people who got desperately ill were, most of the time, they were a week into their symptoms. So that was a little unusual. The other thing that I would say about it is that the complications tend to keep cropping up even after people have recovered. The vascular issues that come up, the blood clots, the strokes, some of these have occurred, long after the respiratory issues have resolved in some patients.
I think it's still a big, huge problem. It's going to be, and people need to be taking it seriously. I think they need to be wearing masks, and I think from a personal perspective of someone who actually have had it, it can really kick your butt. And I even had a mild case, but it was 6 weeks before I woke up and forgot about it.
I think the number one thing is you should be cautious. Granted, things are opening up and everything like that now. I still think people need to be skeptical, and they still need to take precautions and not go crazy and think, oh, that this thing is over. We still don't know if this is more like the flu or anything like that, where you can get infected again. So I would still tell people that they need to be cautious.
And I've told a couple of people, when this all first started, I really thought, boy, I'm younger, I'm relatively healthy, I'd love to just get it and get it over with and get it out of the way. And that is not my opinion anymore. The more I see of this, the more I say, boy, I just don't want this at all. I don't want, nobody wants to get this because there's so many complications that can occur down the road from it. There's even in the people who recover, there's significant concern that the lung damage is going to be permanent, that the scarring that happens from this inflammatory process that can be so severe, these may be things that do not fully recover. And for that reason, the absolute best outcome would be for as few people to get it as possible. And I think that's one of the reasons we really need to still be vigilant is we need to try and be limit as many people as we can from getting the disease, because it's still out there. I know we were a hotspot and we had a lot of people get it, but in the overall population of Cass County, there's still a lot of people who have not had this disease. And most of the patients who were admitted with the disease were not patients that I usually admit. A lot of them are people who had never been to the hospital before, or never really been sick before. And that just happened to do with a particular patient population who suffered the brunt of the outbreak. There's a lot of our patients who have a lot of other chronic medical illnesses, and they have stayed at home, and they've been cautious, they've protected themselves, and they did not get this disease yet. If that patient population were to get this, I think they would be incredibly sick with it. And so I think it's still quite a risk. I think it's still quite a risk for our population. There's a lot of very sick patients chronically in our community who are at risk to do very poorly with this disease. And for that reason, I think until there is a vaccine available, I think we need to be very cautious and continue to use all the precautions that we can.
I worked up in the COVID unit for a couple weeks, and that was just very eye-opening. Some people did really well, but other people that you could just see they were continuing to deteriorate, and that there was nothing that we did that was working, and they would eventually end up being intubated, and then we'd ship out to one of the other hospitals. So it was just a very sobering experience to be involved with that.
One of the other experiences that we have is that you really realize the cost and the impact this virus has when you start to see people that you know, that you work with, that you care about, get infected and are hospitalized. This is real.
I would recommend that we do not get complacent, because if you think back to the influenza of 1918, there was sort of a first wave that was bad, and then there was a second wave that was worse, and we don't want that to happen again.
Moreover, I think that it kind of speaks towards, we should be taking better care of ourselves, because this is something that kind of really hit the people that have more medical problems going on. So overall, I think it kind of sends a message, we need to take better care of ourselves, we need to eat better. I could also speak a lot more on just like the social disparities, because a lot of the minorities were hit a lot more than the majority of population. So there's a lot of messages that this virus itself has sent that I think will hopefully foster a lot more changes just with the medical system, as well as within our nation as a whole.
I would like to share many things, but one thing in particular is that we were very busy during the COVID-19 clinic, and we, as I stated earlier, we ran the 4-H Fairgrounds COVID-19 clinic. All this would not have been possible because of our administration or our leaders putting their heads together and setting up the COVID-19 clinic. So we did make an impact during that time. And also, I want everybody to know that there were many people who, out of the will of their heart, were there for us as well. So many people in the community came and helped, and it was very nice to see that. And then finally, a special thanks to the nurses and all the staff who was there. They were wonderful, and it was a pleasure to have worked with all of them.